Okay, class, here we are into the last chapter for the class. So we're going to be talking about environmental injuries and illnesses. So basically, when you think of a lot of environmental injuries and illnesses, you're talking about things um, that might be impacted by weather, so cold weather, hot weather, extreme conditions with lightning, as well as we're also going to be talking about poisoning. Now, the chapter also discusses bites, stings, and poisonous plants. We actually won't be discussing these topics. American Red Cross does not test on these topics, so we typically don't cover them. If you would like to read them on your own, feel free. There is some really good information in the chapter on those topics. So even though a lot of environmental emergencies can be prevented by taking a variety of precautions, there's no way to completely eliminate the possibility of a environmental emergency happening. Basically, by knowing different types of environmental emergencies, how to identify them, signs and symptoms of them, and some basic first aid, we can try to make the difference between life and death when it comes to these topics. So in this chapter, we're going to discuss and understand heat and cold weather emergencies, as well as poisoning and lightning strikes. So first we're going to discuss exposure injuries and illnesses as a result of weather. So to understand these, we need to understand how the body works a little bit. So our body has its own thermoregulation system, which is the body's ability to maintain its normal internal temperature within what we consider an acceptable range. Now, normal body temperature is around 98 degrees, but people can go upwards to about 99, 100, 101. But your body is able to regulate that temperature. So while the temperature may rise, your body is able to bring that temperature back down again. The thermoregulation system is definitely essential for human survival. If we weren't able to regulate our body's temperature, we would be quickly suffering from heat illnesses and cold weather illnesses all the time. So our body regulates its temperature often with sweat evaporation and shivering. So during hot weather, our body creates sweat, and the sweat is how we kind of pull heat off of us. So when we produce sweat, the environment then evaporates that sweat off of our bodies, giving its ability to cool down. And the opposite, so in cold weather, our body actually begins to shiver. This is an automatic response, so sweating and shivering are both automatic. You don't tell your body to do it, but shivering happens to try to create heat within our body and try to warm ourselves back up again. Under certain conditions, though, the body's thermoregulation system can become overwhelmed and can lead to these life-threatening illnesses. So when the environment exceeds our body's limitations, then we can suffer from heat exhaustion, heat stroke, things like hypothermia. So there are some people who are at higher risks for having these injuries or illnesses happen to them. So those who work or exercise outdoors. Also, those who are elderly and those who are younger. People with medical conditions that that result in them having poor blood circulation. And then some medications, especially medications that are diuretics, which promote the elimination of water from our body and tend to dehydrate us. But other medications can also put your body at risk. So first up, we're going to talk about heat-related illnesses. And heat-related illnesses are caused by an overexposure to heat and the loss of fluids as well as electrolytes. So while most of us think about being outdoors and being at risk for this happening, so maybe you're out for a really long hike and you haven't brought a lot of water with you or a lot of Powerade or different drinks that have electrolytes in them, and your body is rapidly losing fluid because it's sweating and it's not replenishing that liquid with you're not replenishing your body with more liquid so that you can continue to sweat, you're going to then be overloading your body's thermoregulation system and starting to suffer from a heat illness. You don't have to always just be outside to have a heat illness. So people who work in buildings that are don't have adequate cooling or ventilation systems, especially places like kitchens and laundry facilities and factories. So these hot temperatures indoors can also result in people suffering from heat-related illnesses. So the three types of heat illnesses that we're going to discuss are heat cramps, heat exhaustion, and heat stroke. These are in order from, I guess, what you would consider least severe to most severe. So heat cramps are simply painful muscle spasms, and these spasms happen as a result of an imbalance between fluids and electrolytes. So when you're sweating and you're sweating out um, water, you're also sweating out electrolytes. So if you've ever noticed that your sweat dries and you kind of look almost salty, it's because you're losing electrolytes. Our bodies require electrolytes, and when we have a loss of them, we can suffer from heat cramps. Common places for heat cramps to happen are legs and like your abdomen. What you're going to do for someone who is suffering from a heat cramp is have them stop what they're doing in terms of activity, if they're doing activity. Move them to a cooler area. You can have them sip on a drink that contains electrolytes. So some good examples are a sport drink. You can also use coconut water or milk. The person should lightly stretch the muscles that are cramping. So if your calf muscles and your lower leg are cramping, try to stretch those muscles to try to break that spasm. And people can typically resume the activity that they were previously participating in when the cramps subside, so long as they're not presenting with any other signs and symptoms of a more serious heat illness, which we're going to discuss. And it's always really important to encourage them to continue drinking plenty of fluids, especially fluids containing electrolytes, to try to prevent this from happening again. Think of heat cramps as kind of a precursor to heat exhaustion and heat stroke. So if you can catch the heat cramps early enough and manage them and get fluids into someone, you can typically prevent further, more severe heat illnesses from occurring. So heat exhaustion is next in terms of the level of severity. And heat exhaustion occurs when we have essentially lost too much fluid through sweating and we haven't been able to replace that fluid. So maybe, like I said, you're out on a hike, you forget to bring water with you, it's a really warm day and you're sweating a lot, and you haven't been able to replenish what you've lost through sweat. So why we overheat is because we are dehydrated and we no longer have any fluid to sweat so the body begins to overheat. Typically, this happens a lot in your human environments and environments that don't have good air circulation. Signs and symptoms that someone is suffering from a heat illness are things like the skin will appear cool to touch. It would be moist because it is sweating still. It may also appear pale or flushed. And common other symptoms that people complain of are having a headache, feeling very nauseous, dizzy, weak. They might explain like that they are feeling warm. What you should do for someone who is suffering from heat exhaustion is immediately move them to a cooler environment. Try to loosen and remove any excess clothing, especially if the clothing is wet. If you have wet clothing on you, you're not going to be able to evaporate that off of you. So you want to make sure that they have very dry clothing over their skin. If not, remove that wet clothing. Also, by fanning someone, by putting a fan on them, you can increase the ability to have evaporation occurring. If the person is conscious and responsive and very alert, you can have them sip water, or I say a watered down sports drink. It's really important to have them sip and don't have them, chug the water down, because often when they drink too quickly, they'll vomit the water and liquid back up again. So it's really important to just have them slowly sip the liquid if they can do so. You could also begin to cool the person by applying some ice packs or cold towels to them. Now take a minute and think about the locations where you would want to place these cold packs. So common places are the back of the neck, underneath the armpits, in between the legs, close up towards the groin, on the wrists, behind the knees. These are all areas where there's a lot of blood vessels, more superficial, so we're able to perform some more rapid cooling by placing ice packs in this area. If the person is unable to take fluids, their consciousness level is kind of decreasing, if they begin vomiting, we need to make sure that we call 911 immediately. The bad thing with heat illnesses is that they can rapidly progress to the next level of severity very quickly if they're not managed properly. If the person is unable to take any fluid, you can place them in the recovery position while cooling them with the ice packs or ice towels, and monitor them for shock. Commonly, the person will go into shock or any other worsening conditions. Now, heat stroke. Heat stroke is the least common of the heat illnesses, but it is the most severe. And we really want to try to catch someone before they get to this point in time, because death is fairly common when someone is truly suffering from heat stroke. So basically what's happening now is the body's cooling system is completely on overload and it stops working altogether. It is considered a life-threatening emergency. So at the first sign of heat stroke, you really should call 911 if you haven't done so already. The signs and symptoms that someone's suffering from heat stroke are changes in mental status, confusion, as well as loss of consciousness. They may go into seizures. Their skin appears very dry, and it is also really hot to touch. It may also appear reddened. They may be vomiting. And their breathing is a lot like shock in that it's going to be rapid, shallow, and their pulse is also going to be rapid but weak. What you should do, like I said, at the first sign of shock is call 911 immediately. Attempt to rapidly cool the person. So, if possible, the preferred method is cold water immersion. So, trying to place them in a tub full of ice water up to about their neck, but you want to make sure that you can do this safely. You're able to hold the person above water so that they don't go unconscious and slip under the water and then drown. If you don't have that as an option, you can cool them with the ice bags, packing them in those same areas that we mentioned for heat exhaustion. And you want to rotate these cold packs every like 20 minutes because they are going to not be cold anymore. So you want to make sure you're constantly keeping cold packs on them. Give any other care that is needed while you're waiting for help to arrive. This person could go into cardiac arrest, so you need to be ready to care for cardiac arrest. So like I said, what's really important in heat illnesses is A, trying to prevent them from happening in general, but B, trying to prevent them from leading to heat stroke. If you can catch someone in the heat cramp and heat exhaustion stage and provide proper measures to cool them, to get them rehydrated, you can help to prevent heat stroke and death as a result of a heat illness. Cold related illnesses, so opposite of hot weather emergencies. And these happen from exposure to cold, wet, windy environments. And they can cause most commonly two types of cold weather emergencies: hypothermia and frostbite. So just as we had heat related emergencies and we discussed preventing them, we really need to try to prevent cold weather emergencies if possible. So making sure that you're preparing if you must go out into cold environments. In box 7-1, it discusses how to dress for the cold weather. And what you want to think about when dressing for the cold weather is you have a base layer, you have a middle layer, and you have a shell. Now, your base layer is the layer that's right next to your skin, and it's going to try to help regulate your body temperature by wicking away any sweat off of your skin to keep you to keep you dry. It's important that this fabric does have a wicking feature to it, and things like silks and merino wools and some other synthetics such as like your Under Armour cold gear, your Nike cold gear, can help wick away the moisture. Cotton isn't always a good choice because cotton tends to actually trap that moisture in instead of wicking it away. The middle layer needs to be some type of insulation that can retain heat. And commonly things like wools. So I think of like a wool sweater or like a fleece layer as being a good option for this for your middle layer. And then the last layer should be a shell or an outer layer that's going to protect you from wind, rain, and snow. This layer should be waterproof but breathable. And you should be able to have enough room under this layer to put your base layer and your middle layer under. Some other things you want to think about are also wearing things like hats, scarves, mittens, gloves, and warm socks and water-resistant boots to try to keep out cold, wet weather. So the first one we're going to talk about is hypothermia. And hypothermia is similar to that of our heat exhaustion, heat stroke. It's just the opposite. So now our body is losing heat faster than it can produce heat. And what happens is the core body temperature starts to drop to temperatures below about 95 degrees Fahrenheit. Commonly as a result of exposure and prolonged exposures to cold air and water. So you think about situations like being outside when it's very cold, it's windy, it might be snowing or raining outside. Or also situations of people falling into lakes and creeks when the temperatures are cold outside as well. Signs and symptoms that someone is suffering from hypothermia are being disoriented and confused. Tell people they almost appear very slowed down and everything. So their speech is commonly very slow. They move in a very slow way. They may be shivering, but as the hypothermia progresses and becomes worse, they actually will stop shivering altogether because your body has basically given up in a way. They may be unresponsive or have a very altered level of consciousness where they, appear very out of it. The breathing is very slow, and it may result ultimately in them stop breathing altogether. And the body becomes very rigid. The muscles become very rigid to touch when you feel them. You should call 911 immediately as soon as you identify that someone may be suffering from hypothermia. Hypothermia is can be very fatal. It should be kind of thought as our heat stroke, in that it's the most severe of the weather emergencies, and they are going to require more advanced help to treat them. You might need to administer CPR, the use of an AED, if the person is unresponsive and not breathing. And you should always be ready to do this if the person isn't at that point in time yet. So this is slightly different than when we were managing heat-related emergencies. We try to rapidly cool someone. However, when we're dealing with hypothermia, we actually want to gradually warm someone. We can do this by moving them to a warm area, removing any wet clothing and replacing that with dry clothing. We can wrap the person in warm, dry blankets. You could also place the person near a heat source, but you don't want to put them too close to the heat source. And really should only do this if medical care is far away, if they aren't going to reach you very quickly. If that's the case, you could also apply heating pads and hot water bottles to warm the person's body. And then lastly, you just want to make sure that you're monitoring the person until help arrives. So keeping an eye out for changes in consciousness, the person going unconscious, the person going into cardiac arrest. You could also, if the person is very responsive and alert and able to swallow something, You can have them sip on a warm fluid, such as just like a clear, regular broth or warm water. You want to make sure that you're not giving them things that are caffeinated, like teas and coffees. Really, you just are looking to do some type of clear liquid, like I said, maybe a chicken broth or just warm, straight water. Frostbite is the other type of cold weather emergency we're going to discuss. And frostbite is actually the freezing of the skin, and as it progresses, the underlying tissues. And this can result from prolonged exposure to extreme cold temperatures. The common areas that people have frostbite is in their fingers, on their nose, on their ears. I've seen it on people's cheeks and foreheads before, on their face. It can also happen to the hands, the arms, toes, and legs. And the signs and symptoms of this are the area feels numb to them. It may also appear waxy. So the picture down to the bottom left is a waxy looking frostbite. Those are earlier stages of frostbite. As frostbite progresses, it may become very red. It may blister up. And in the most severe cases, it's actually going to blacken, as you can see in the picture on the right. And that's when the tissue has died completely. A complication of frostbite is that the person may actually lose the area that has had frostbite. So the person on the bottom right, those fingers, could actually break off fairly easily. And they are going to result in amputation because of the tissue death. Also, the area is going to feel very, very cold to touch. So what we're going to do, so in the severe cases, and when someone is showing signs of hypothermia as well, we're going to call 911. Always make sure that if there are blisters, you don't ever break them. And monitor the person and care for them as needed. So in these cases, they might be going into shock. Like I said, they might be suffering from hypothermia. So you just want to make sure that you're monitoring, caring for those situations. If someone is suffering from milder cases of frostbite, such as the picture at the bottom left, you want to make sure you handle them gently. And this is in all cases, hypothermia, extreme frostbite. You want to make sure that you're handling the person very gently. Never ever rub the area to warm it. Rubbing it can actually cause more damage and can result in the tissue peeling or breaking away. And always remove any wet clothing that's over top of the area. Never attempt to re-warm a frostbitten area if there's a chance of refreezing. So if you're in the outdoors and there's a really good chance that the area could freeze again, you actually aren't going to even attempt to rewarm it. But say that you've actually brought someone indoors, there's good heat sources inside to keep them warm. You could rewarm the area. You can do this with skin to skin contact by just kind of cupping your hand over the area or placing your hand next to over the area. In very mild cases, this is sufficient. However, you can also rewarm the area by soaking it in warm water until normal color and appearance return to the skin. The temperature of the water should be somewhere around 100 to 105 degrees Fahrenheit. And if you don't have a way to test the water, basically by putting your own hand in the water and feeling that it is, I say, like slightly warmer than lukewarm, okay? But it's not very hot when you put your hand in it. then that is okay in terms of temperature. You could also, after rewarming the area, make sure you bandage and wrap the area with a loose bandage to continue to keep it warm and dry. Figure 7-1 kind of demonstrates the rewarming by immersing into the warm water, as well as how to loosely bandage the area. So that's it for our cold and hot weather emergencies. Now we're going to discuss poisoning, which we don't think of poisoning when you think of like the actual environment always, even though you can ingest things that are out in nature that can poison you. But poisoning is any substance that can cause injury, illness, or death whenever it's introduced into the body. Commonly, we become poisoned by the poison entering via ingestion, which is swallowing it, inhaling, so breathing it in, absorption, so the chemical coming in contact with your skin and it absorbing that way, or being injected. Basically, anything can be a poison if it isn't meant to be taken into the body. And sometimes things that are even things that we're supposed to take, so such as medications, can also turn into poisons, especially when they're taken in combination with things that they're not supposed to, or they're taken by someone who shouldn't, or by taking too much of it. Poisoning can really happen anywhere at any time. The most common people who are poisoned are young children, especially those who are of like toddler age, so somewhere below 4 or 5 years old. And what are your thoughts on why children are commonly those who are at higher risk? So you should be thinking of, children like to put everything in their mouth, okay? So they see something laying on the ground, they pick it up and they put it in their mouth. Especially things that are kind of attractive in nature as how they look. So they might be a color that appears pretty to them. So maybe something that's a bright color, bright yellow, bright pink. It might not be the actual liquid is that color, but the packaging is. Retailers use a lot of packaging that catches our attention in terms of purchasing it. But remember, it's going to also attract those young children's attention, and they might say, "Oh, that looks good." Also, things that are kind of sweet smelling. They might also be outside playing and put a plant or some type of poisonous berry in their mouth. Medications can look like candy to them. One new, more common poison that's happening is those laundry pods that you can see in the bottom right corner. They see one of those and they pick that up and they put it in their mouth. In box 7-2, it lists a lot of common household things that are poisonous that you want to make sure that you're keeping away from younger children. Also, older adults and those who have vision impairments can also be high risk. So older adults, as they start to become more confused, or they might be suffering from things like Alzheimer's or dementia, they might also take something like this unintentionally and become poisoned. So you also want to make sure that you're protecting them from coming in contact with these common household products. Box 7-3 talks about how to lower the risk for unintentional poisoning. So, where to put things, what to be aware of, um, how to safely store items that are poisonous to people when they come in contact with them. Commonly, causes of death from poisoning are a result of poisons such as drug overdoses. So whether it be someone taking too much of an over-the-counter medication, or a prescription medication, or a street drug. Also, alcohol poisoning, so consuming way too much alcohol, as well as carbon monoxide poisoning. Box 7-4 talks about drug overdoses as well as alcohol poisoning and carbon monoxide poisoning. So I encourage you to read and review those boxes, box 7-2, 7-3, and 7-4 for more information about poisoning. So in general, the signs and symptoms that someone may present with, they really depend on, what did they consume and how much did they consume of it. Sometimes someone can consume a very, very small amount of something that's considered poison and not show any symptoms at all. So commonly we have gastrointestinal signs such as stomach pain, nausea, vomiting, and diarrhea. Respiratory signs such as difficulty breathing, slowing in breathing, shallow in breathing, and they stop breathing altogether. Neurological signs such as changes in their level of consciousness, being confused, having seizures, headaches, dizziness, weakness, and maybe changes in their eyesight, pupil irregularity. They might complain of everything seems very blurry, and unusual skin colors as well as sweating. You want to make sure that you size up the scene in these situations. So what can be a clue that someone has been poisoned? You might just come into the room and find that someone is appearing very ill. So remember, you have to use your sample history, ask them questions if you can, ask people around you, size up the scene to try to figure out what's wrong with them. They're not always going to be able to tell you. So you need to try to use those skills that I taught you early on in this class to try to figure out what's wrong with them. So what are some indicators? Do you see a spilled container? Do you see an open cabinet, an open drawer? Do you smell kind of some unusual odors? Does the person's breath have a very unusual odor? If you think someone has been poisoned, try to determine a few things. So see if you can figure out what they possibly ingested or however it entered the body, how much of it they took. If you can determine how many pills they took, how much of the liquid they drank, how long ago it was taken, and approximately how much the person weighs. These are all going to be really helpful information to provide people when they come to help in the situation. So how do we care for this situation? We always call 911 if there's any signs of life-threatening emergencies. And I tell people, if someone is very, what's considered a life-threatening sign or symptom? Well, you all know, changes in consciousness are life-threatening. Seizures can be an indicator of a life-threatening emergency. Extreme changes in their breathing. But also remember, if someone's vomiting and vomiting a lot, that should be an indicator. If they seem very out of it, maybe they're having extreme stomach pain and chest pain. So take all of those into account. So if they're showing any of these life-threatening signs or symptoms, call 911 to try to get more advanced help there for you. If they are alert and very responsive, you can actually go ahead and call the National Poison Control Help Hotline, 1-800-222-1222. Box 7-5 talks about the Poison Control Center. And Poison Control Center is staffed with people who are going to be able to give you professional medical advice based off of what has been consumed. They might tell you that you need to hang up and call 911, or they might give you other advice. So things to look for, you might be able to take them to the emergency room yourself. You might be able to take them to an urgent care, or take them to your primary care physician. So they're going to give you some advice as to what to do, but you want to make sure that you have that information to provide them. So if you can tell them what they took, how much they took, approximate weight of the person, how long ago they took it. In general, for whenever you're dealing with someone who appears to be poisoned, try to remove the source of poisoning if it hasn't been done so. Just make sure that you're not endangering yourself. Don't ever give them anything to eat or drink unless further help has told you to do so. So if you're on the phone with poison control and they tell you to give them water to drink, or maybe you're talking to 911 and they tell you to do that, then it's okay to do so. Don't ever think yourself, that you're going to give them a bunch of milk or water to try to help absorb the poison. You want to make sure that someone is telling you to do so, because they can counteract sometimes. If you don't know what the person has been poisoned with, it's actually really helpful if they have vomited to save a sample of that so that they can test it to try to determine what they have consumed. And then lastly, lightning strikes. So lightning is obviously an environmental hazard, and being outdoors during lightning is very dangerous. A lot of people are like, it seems far enough away. I'm not going to get struck with the lightning, but you can get struck upwards to when the storm is still like 8 or 9 miles away. So you always want to make sure that you're erring on the side of caution whenever dealing with being outside during lightning storms. So anything that's tall or towering, such as a big tall tree or a building or a person, can become the path for that electrical current from the lightning. And you want to make sure that you aren't the person that it strikes. Lightning can flash through someone's body. It could also travel completely through the body and ground back down to the ground. There are different types of lightning strikes and how they occur to someone. You don't need to know or understand them. Just know that you can actually be struck by lightning. Sometimes I have people say, I didn't think that was really a real thing, that you could actually be struck by lightning. You could be struck directly by lightning, or you could be in contact with something that is struck by lightning, and that energy can travel through you as well. Lightning strikes can result in injuries such as burns, where the electrical current comes in and then exits the body. It also is a common cause of cardiac arrest. And if it causes enough force, it can actually throw a person through the air. And when that happens, you can have more traumatic injuries like fractures or dislocations, massive contusions, maybe internal bleeding. The signs and symptoms that someone has been struck by lightning, so might just be an indicator you might have seen it happen. Okay, so don't ever forget to kind of be aware of your surroundings. What did you see? What did you witness? What can that tell you? The person may appear very dazed and confused if they are responsive. If they might be unresponsive. They might be unresponsive and not breathing. They may be in cardiac arrest. And then there might be indicators of these burns or open wounds or other injuries that could have occurred if they were thrown. Always look for an entrance and an exit wound on someone. So these entrance and exit burn type wounds. What you're going to do for someone is always call 911. Even if someone appears fine, you want to make sure that they get checked out by a healthcare provider. So always call 911 in these emergencies. If the person is unresponsive and not breathing, be prepared to administer CPR. Have someone go get an AED and use the AED. And then provide care for any other conditions you might find. So they might be responsive and alert, so you might need to use basic first aid to take care of the burns, take care of any open wounds, potentially any muscle, bone, or joint injuries. And they could possibly also go into shock. So being prepared for all of those different conditions that could happen. Box 7-8 talks about avoiding lightning strikes and really, how to prevent them. People shouldn't be struck by lightning. We should be using common sense and taking standard precautions to reduce the risk of this happening. Now, it is going to happen. It's always going to happen. But trying to drastically reduce the amount of times this happens is really important. If you're outdoors, make sure that you're seeking cover in a safe building. So I always use the little phrase, if you see it, flee it. If you hear it, clear it. Okay, some people say, well, I see some lightning, I don't hear any thunder. It seems like it's really far away. I think I'm okay. If you hear any thunder, if you see any lightning, just go ahead and seek shelter. Now, what's considered a safe shelter? Well, standing underneath a tall tree is not a safe shelter. Standing in in an open metal pavilion is not a safe shelter. Okay? You need to make sure that you're in some type of substantial type of vehicle that's fully enclosed. So, whether it be a building, an actual true building, it be an actual automobile, like a car or a bus. You can utilize the 30-30 rule, which basically states take cover when the time between the flash of lightning and the roll of thunder is 30 seconds or less. And then remain in that safe shelter for at least 30 minutes after the last flash of lightning was seen or the last roll of thunder was heard. Now, if you're outside and you can't reach any safe building, try to find something that's a low area. Always avoid any standing under any high, tall trees, especially if they are standing alone by themselves. Avoid things such as meadows, so wide open spaces where you're going to be the tallest thing in that wide open space. And structures such as sheds, dugouts, bleachers, like I said before, pavilions, these are all not considered safe buildings. Sorry for the cough. If there aren't any safe shelters, what you can do is bring your feet together and your arms wrapped around your legs, kind of in a squatted position. Stay kind of low to the ground without laying flat on the ground. Basically, you want to have the most minimal contact with the ground as possible. So by squatting down and only having your feet on the ground with your body kind of tucked around your legs, this is the safest position to be in. Remember, if someone has been struck by lightning, and the weather is very dangerous and imminent around you, always check the scene for safety before you put yourself in an emergency situation where you can be at risk of being struck by lightning as well. Bites, stings, and plants. The American Red Cross doesn't really put any stress on these topics. You will not be tested on these topics. You will not be quizzed on these topics. So basically, pages 128 through 139, you don't need to know. You are more than welcome to review this material if you want to. There is some really good information in here. But for the purposes of this class, you will not be tested or quizzed on this material. Okay, so in review, go ahead and review the following questions. Try to answer the following questions. As always, these topics are up for discussion in class. You might be quizzed on these topics, tested on these topics. But make sure that you are reviewing the chapter along with the PowerPoint. There are some really great boxes, tables in this chapter that give you a lot more information than we just discussed about during this PowerPoint presentation. I will see you next week.